It's streaming now.
Yeah, it's good.
Good evening, one and all. Welcome back to another interesting and powerful episode of Tea Talks Tuesday. So we are here in our Tea Talks is into its second anniversary month. So May is this is the month we are into the second anniversary, and we plan to bring in exclusive content for this month. Tea Talks Tuesday begins its journey during the first lockdown of COVID, and COVID-related topics were our initial talks. Now we are 2 years old and COVID too. While new variants are sabotaging us in their own way, long COVID remains to be tackled with the lifestyle changes. So we are here today with Dr. Anjali Agarwal. She is here, and she's going to discuss on long COVID symptoms and all the necessary corrections which are needed for that. And I would like to request. Sorry. So I request Dr. Janki Garu to invite Dr. Anjali Agarwal onto Tea Talks. Over to you, Doctor.
Thank you, Mayuri, and welcome Dr. Anjali Agarwal once again to Tea Talks Tuesday. It's always a pleasure to have you because very good. All your sessions are always informative and very practical to that. Since you being a physiotherapist, I think you know how to really put into practice things physically, and we really get really good tips on how to do things, which is very, very important and simple way to practice also. So I know everybody knows Dr. Anjali. Since I think last two sessions she has given on Tea Talks so far, and I think this is the third session. And she's a consultant physiotherapist and a lifestyle consultant and a heart manual facilitator and a childbirth educator too. And she's available for consultation on consultation online consultation, that is teleconsultation. You can call her on 7981 63770. I'm repeating 7981 63770. You can call her and take appointment for her consultation. Why she is here today, especially talking on long COVID, is because she's also the advocacy co-director for long COVID physio worldwide. That's why she's here today to talk about to clear our doubts on long COVID. So here we go. Welcome, Dr. Anjali. And our first question will be, what is long COVID?
Thank you, Dr. Janki. Thank you, Mayuri. And thank you, Tuesday Tea Talks. It's lovely to be back again with all of you with a cup of tea. And thank you, everybody, for joining. And I think 2 years into this pandemic, and I thought we would be done and over with COVID. But what lingers behind is the aftermath of the tsunami which COVID leaves behind, which is the long COVID. So till 2020, in the beginning months and post months of 2020, many of us, we were seeing a lot of patients with long-term disease conditions and symptoms, which was coming after post-recovery of the COVID. And it definitely doesn't mean that one has recovered out of COVID. Many are asymptomatic. So many don't even have symptoms of COVID, but they have long COVID symptoms. And among the long COVID symptoms are a list of plethora of symptoms, which could be simple like brain fog, cognitive decline, breathlessness, lot of muscle body, joint pains, lot of vertigo issues, POTS. POTS is something called as dysautonomia, which we see in a very big room. I see among a big room, I'll see about 80 patients having POTS because of long COVID. So long COVID is something which is showing as a prolonged illness, months and weeks and years after one has had COVID, or one has not known one has had COVID also. So many of the times patients are mistaken. They think that my RT-PCR reports are negative. My results of COVID never came as positive. But when they come and have a chat with me and they complain about long-standing pains which are not coming down by any kind of means, if they are having dysautonomia or rapid heart rate which is not coming under control by any means, all these are signaling that these are all kind of parallelly going with the symptoms of long COVID. And as we say that this is all falling in the term of acute viral illness. Whenever somebody has any viral infection and whenever somebody is recovering out of a viral infection, all these things come under the viral fatigue syndromes, viral encephalitis, and everything is correlated with long COVID. So that's how the term long COVID came, as instead of terming it as post-COVID, we started to call it long COVID.
Except that doesn't have fever probably. Long COVID, we won't have fever. Maybe we don't have infection, but post effects of COVID will be there and they'll be continuing. And they cause organ damage?
Yeah, so now we look at the autopsies and all, we see a lot of lung damage, kidney damage, liver damage. It's actually wherever there is AC2 inhibitors. Basically, the COVID virus attacks the AC2 inhibitors. So we have maximum of AC2 inhibitors on our blood vessels. So when it attaches to the blood vessels, that's the time when we are seeing the maximum damage happening in the vascular component of the body. And when the vascular component is hindered, the endothelial lining is hindered, a lot of blood flow, vascular changes are happening. So it's causing a lot of maximum damage I've seen is with gastrointestinal. A lot of them have hemorrhage inside their intestines. They also have lung damage and they also have a lot of heart inflammation or myocarditis, which we are now seeing in a lot of patients. Now the research has come from BMJ studies and all, and a lot of studies have come from the Endocrine Society of American College also, which says that 1 year post recovery of COVID, every patient should be very, very mindful of the heart diseases or the heart inflammation, anything which is related with diabetes or inflammation of the lung. So, and we've seen a lot of people recurrence of cancer. They had recovered, now they are coming up with recurrent cancer being coming back also. So yeah, it definitely does the long organ damage. Yeah.
Now talking about the heart inflammation, what are the signs and symptoms that can we detect it early so that we can take an action?
Regarding the heart inflammation?
Heart inflammation.
Yeah. So, you know, like many of the patients would say that I have been to the cardiologist and my echogram, my ECG all have come normal. My blood tests have all come normal. So this is a hidden elephant in the room, basically. We have symptoms and we don't know what's happening in the body. So basically what we now have found out is there's a lot of microclotting which is going on in the blood vessels. As I said, the blood vessels are really attacked in cases of long COVID. And what's happening is that this microclotting is actually compromising the blood flow in the entire body, and which is not letting your heart do the efficient work of pumping the blood and exchanging good blood and bad blood kind of factors. In layman terms, I'm just making you all understand. And what happens as a result of that, the heart walls are inflamed and also the epithelium. You know, the heart is made of the myocardium wall, though that is inflamed. And as a result of that it is an injured heart basically. So its efficiency to pump blood, efficiency to let you do any workouts also is decreasing. So what I am doing in my clinical practice is very, very simple, because many of my patients will say, my cardiologist has told me that everything is normal. Nothing is wrong with you, but your heart rate is really coming high. So what is the thing is, when they're lying down, their heart rate will be all fine. But as soon as they stand up, even for 5 minutes or 3 minutes, their heart is just jumping to 140, 150, and some for 200. And for daily tasks like going to the kitchen and standing and making any kind of food is taking away all their energy. So they're getting very fatigued. And then
Right.
they go to the cardiologist saying that I don't feel that my heart is really efficiently doing the work. But they say your tests are all normal. You seem to be all normal. Your blood tests are all coming normal. Your D-dimer is fine. Your CRP is fine. The inflammatory markers are fine. But what we see is this is called as the dysautonomia phenomena, which we see mainly with heart inflammation. But people are not understanding that this is actually dysautonomia or POTS, which is not actually a heart inflammation showing in blood test, showing in echocardiogram, but you have to overrule dysautonomia.
Okay.
How do we overrule that? In the sense, is there any other test other than this, or just by way of understanding that we are having palpitations, or we may be having breathlessness, or we may be feeling weak, or we may be having general joint pains or general body pains, feel like lying down? Are these
So,
to be
yeah.
considered as symptoms, or how do we go about it?
Yeah, so maximum of the patients will have the inflammatory markers going up. Could be many have very high CRPs and very high D-dimers, which we see in COVID infection also. Any infection, any inflammation in the body will cause your D-dimers to go up or your CRP to go up. But classically, what I see now in patients is the CRP is all normal, the D-dimer is all normal. Especially what we see is LDH. LDH is something which denotes that there has been a muscle injury in the body. That seems to be coming very high in few of the patients. And many of them also have very gross reduction in vitamin D and B12. So we have to understand that COVID virus is actually feeding on the vitamin D and the B12 in the body when it's fighting infection. So majority of them may have good vitamin D, B12 when they were fighting the COVID infection, but now post the COVID, I see majority of them is having a deficiency. And that alone will cause inflammation, which is building up over and over again, because low vitamin D again constitutes for high inflammation in the body. So one test which is being done in Germany now is mainly on the microclotting factor. Manasa is in Australia. She can tell more about it also. A lot of my patients who are in Germany and in UK also have got a test done, especially for microclotting factors and all. So yes, definitely there are several tests done, but the gross ECG and the gross echo doesn't tell a story. The gross PFT also, the lung function test, is also not telling a story. And especially in cases of lung, we don't see gross lung, FVC or the lung volume reduction of capacity. But what we see is breathing dysregulation. So people don't know how to breathe well after a COVID. And that is what is causing the breathlessness, rather than actually saying that the lung alveoli are inflamed or something to test for a peak flow meter test, which is coming as normal. But what we see is many people have recovered well after COVID. PFT is coming normal, but they have breathlessness. So it's like a hidden elephant in the room. With a lot of things, but we don't have an answer. But these are the things which we really need to focus on.
Okay.
Manasa, would you like to add anything to this?
Pardon?
Manasa.
Yeah, Manasa can talk about it. Yeah.
Hello, everyone.
Hi, Manasa.
Hello. From me.
So Manasa, you had the microclotting test, no? Please give some little bit details on that.
It's not a negative. I got all tests, got negative. LDH and microclots, everything negative. ECG normal, but I'm still continuing the pain. I'm using the painkillers from last 6 weeks, but nothing changed. I can't even do my daily walks. Just before I done the heart rating, I recorded for the Anjali. While standing up for 3 minutes, I unable to stand up. After I stopped the video, I slept on my bed. I can't even stand for continuously 3 minutes.
Oh.
Yeah, I don't know what to do. Like here, they done all the tests, or everything is negative. They don't know what to do now.
Okay.
They all keep changing the antibiotics, I mean painkillers, but nothing. Now they are saying I'm depressed and anxiety. They're giving
Okay.
tablets for that now. Yeah. Hope
So
so.
what?
I will get good results in next few weeks with Anjali.
Yeah. What do you suggest, Anjali?
So yeah, we will be working with Manasa now because like the answer is very clear, right? We don't have to really look at because our ANA factor, RA factor all came negative. And the orthopedic surgeon is giving her painkillers and anti-inflammatories, but there's no inflammation. Why do you give her anti-inflammatories? That's a
Right.
very big question.
Yeah, I
So
contact in sorry to disturb. I contact in orthopedic in India. They give my dad's friends. So they just give some medicine like for the painkillers, inflammation related vitamins or something. They just give the prescription. I told them like I don't have any inflammation. I done the test, like it got negative. So anyways, here the doctors doesn't allow to give these medicines.
Right.
Yeah.
yeah, so as I said, there's a lot of things going with long COVID is mainly with the blood circulation. And that is the main factor in many of my patients because the joint pains are not actually coming because there's inflammatory arthritis there. But why is it developing over there is because of diffuse oxygen exchange between the muscle and the blood is not happening in many of this long COVID patients. So if the oxygen is not reaching your muscle, you tire out very easily, right? Oxygen is our life, and we can work efficiently only when we have good oxygen in our body. So every body cell requires good oxygen, and we have another patient fully recovered. That's Happy. So Happy can talk about her journey with me. It's been 4 months with her, and she's recovered.
Great.
Happy, yeah. Welcome to the show. Yeah.
Hi,
Hi, good
Happy.
evening, everyone.
Good
Good
evening.
evening.
Yes. So I have been with Dr. Anjali's under Dr. Anjali's treatment for about 4 months now. And it was my good fortune to actually get in touch with Dr. Anjali. And she has been such a blessing. I can say that she has, in addition to the physiotherapy, she has also suggested some changes in diet, as well as some mental exercises like drawing, creativity, and things like that, that actually help you heal faster. And I'm so delighted to tell you that in 4 months, I have actually reversed the POTS.
Wow.
Yes. So it is really, like I said, I have been visiting the doctors for, I think, from August onwards. And every time I had a panic attack or elevated heart rate, I visited a doctor, first a cardiologist, then they said there's nothing wrong. After a 2D echo and an ECG, and then I was directed to a neurologist. And he also said, he made me walk, he made me do a lot of exercise, and he said, there's nothing wrong with you. And sometime after visiting about 2-3 doctors like this, and nothing is wrong, but just one-off case and things like that. Then finally I consulted Dr. Anjali, and she told me that I could have had an asymptomatic COVID, and because of that, I have got the spots. So yeah,
Okay.
and within 4 months, I think within 2 months, there was a lot of improvement. The last bit took me about another 2 months, but
Okay.
it is really, really, I think, see, when Dr. Anjali says, the tests don't actually show you anything, then I keep asking her, what is and see, I have been fortunate enough to contact her and get this treated, but not everybody is fortunate. So what do they go by if, tests are not reliable?
I know.
Yeah.
True. True.
Correct. We can only spread the awareness to our friends and family. That is what I'm doing. But the general public, how do we reach this message to them?
The teatalks is the platform now. I mean, that's why we invited Dr. Anjali to speak about
Yep.
this long COVID. This is one of the platforms because
Yes.
so many people will be watching this
Yeah.
Not only now, after this talk over also, and then this content will remain forever. Anybody
Okay.
can look
Yeah.
into this anytime.
Yes.
Thank you, Happy.
Yeah, I take this opportunity to thank you once again, Dr. Anjali. Thank you so
Thank
much.
you, Happy. Thank you so much.
Thank you. This is very nice discussion. In fact, getting your clients and who actually went through your process of healing. I would say I think you are a holistic healer now. It's not just a physiotherapy. You are into combination of things probably customized to the patient. Now, before we go to any next question, others who are here, Vani Garu, Dr. Suresh Garu, Pranita Reddy, Venkatanaran Garu, and Mayuri. Please, if you have any questions, please ask now. I'm coming across one common word called nitric oxide load. Exercises. Vani, you want to talk?
Hello, hi Janaki Garu.
Hi.
Hi Mayuri Garu.
Hi, Vani
Dr.
Garu.
Anjali. Happy to see you all on one screen.
Yeah.
Yeah. The last year, the same time, like actually my husband affected with COVID, and post COVID, definitely I could say there are so many after effects I have seen so far. So he got diagnosed with hypothyroidism, and his muscle became very weak. And of course, like many other people are affected with diabetes and other degenerative diseases like heart inflammation or heart enlargement, whatever Dr. Anjali was saying. So definitely there is a bad impact of COVID on almost 90% of the people who got affected, Janaki Garu. So the thing is like whatever superficial tests we are doing with, we can understand like, okay, these levels are not up to the mark, maybe the ranges are different. So it could be vitamin D deficiency or B12 deficiency or whatever, thyroid TSH levels and all. But in-depth analysis we won't be doing. Usually we won't be going with this in-depth diagnosing tests with our body. So what are the major or mostly seen conditions of this post-COVID effects? Like I just wanted to know, apart from these conditions, like whatever Dr. Anjali was speaking about. So what else can be done? Like apart from these major tests, what else the other tests can be done, so that by taking this in-depth analysis, we would come to know like what exactly the other treatments we can taken care of.
Yeah. So actually, long COVID is a mystery. The word is mystery. We're still learning and we are still on the job. I think the disease is new, the symptoms are new, and whatever we have done as so far for all my patients is because I used to see a lot of dysautonomia because of post-viral illness prior to COVID. So the major term, Vani, I'll say is always look into dysautonomia. That's the umbrella term for all the symptoms most of the post-COVID patients are seeing. And most of the post-viral patients will have dysautonomia by default. And the maximum of the patients are also complaining of Sika syndrome or Sjogren's syndromes, which is dry eyes, and a lot of scleroderma, which we see, like, you know, the
even
skin
sorry to disturb, even their skin becomes so sensitive and they are ending up with skin allergies too, doctor.
Vani, yeah. So it's all coming under dysautonomia, which also has something called as MCAS. I think all of you know about something called as MCAS, which is mast cell activation. So mast cell activation syndromes are very common in Ehlers-Danlos syndrome, which is the hypermobility or the Ehlers-Danlos EDS formats of genetic disorders. And many of them, it's called as a trifecta of hypermobile joints, MCAS, EDS. And MCAS is something where your body is in a fight and fight mode all the time. And the COVID virus actually does the exact same thing when your body goes in a fight and flight mode, which is a cytokine storm in the body. So anything with your skin, anything with your digestive gut, which is your, whatever you're eating, whatever you are doing, everything, your hormones, everything will be controlled by something called as MCAS. And MCAS is a syndrome which will affect everything, which is your diet, which is your sleep, which is your food. It's a big term, and this is all falling under dysautonomia. And from 2020 onwards, I have been talking about MCAS also, because I also treat MCAS and dysautonomia prior to COVID. And it just by default, it happened that COVID also gave us, long COVID gave us the same symptoms and the same dysfunctions of the body. So basically, we have to understand that the body is still fighting some viral replication in the body, and there is some viral residue which remains behind the body. The body is always into a bit of a cytokine flight and fight mode. And that is why your skin irritation, your digestive gut, many patients have also complained of total reversal of their period cycles. So women are telling me that they don't get their periods, so they've reached their menopause at the age of 26, 27. These are very young girls. And then we have many who have got endometriosis after getting COVID. So what is endometriosis? Again, is an inflammation, which is again affecting your uterine lining, which grows outside your uterus. And that again is acting like AC2 inhibitors, attaching the COVID virus, and that is going into MCAS mode, again giving that allergic reaction to the body. So what is MCAS in layman terms? It's an allergic reaction which your body generally keeps fighting with in terms of gut intolerances, leaky gut. You might see a lot of patients complaining, I was able to eat this food before COVID, I cannot digest anything now. Many women are complaining that once their periods are coming, they have very bad headaches. They feel like they will fall off. They don't have energy to get up from their bed. They're not able to eat food. Like if they were eating papaya, they're not able to digest that. If they were eating apple, they're not able to digest that. So all these is a sign that your body is definitely showing a allergic reaction, which is also called as MCAS in short terms.
Okay. MCAS.
MCAS, yeah.
Okay.
And how about the neurological complications, Anjali? So see, I mean, anxiety is something again which they are experiencing during the COVID and post-COVID also. Like one of the patient who was sharing, who was also having a kind of anxiety. And how about these neurological related issues?
Yeah. So we have a lot of patients with a lot of cognitive decline. I have patients with total dizziness and vertigo every second of their day. So they can't actually look at the screen. They have constant vertigo. As a result of that, they're able to concentrate in their many jobs or activities throughout the day is also getting hampered. They don't remember. Their short-term memory is getting affected. They might remember long-term memory is okay. Short-term memory is getting affected. So it is what we say is called as a small cell neuropathy. Basically, COVID virus is also causing some kind of a neuroperipheral neuropathy, and also the small fiber neuropathy, which is affecting various cells of the body, which is actually helping you perform little mini cognitive tasks and all. They feel like they feel tremors all over the body, and they might feel a lot of insomnia, not able to sleep in the night, and a lot of tremors in their night. And many of my patients now have multiple sclerosis. So again, if you know about multiple sclerosis, it's also an inflammatory condition. And if it's also showing in people who have low vitamin D. So maximum of my patients have shown that the vitamin D was very low during the long COVID, and also during the COVID, they never knew that they should have taken vitamin D. So that is a major issue which I see in cognitive decline of these patients, is that lot of mood swings. They're feeling like crying all the time. They're not able to, understand and prepare a whole speech with somebody also. They can't converse with anybody because when they go to talk also, they're not able to utter a single word. So there's a lot of speech delay which is happening in adults, in elderly also. A lot of patients have got Parkinsonism also. So I think COVID has just caused a havoc in every aspect of the body. So we are seeing a lot of conditions just flare up after having had COVID. Yeah.
We are yet to find correct, appropriate, just like how we are yet to find appropriate vaccination, yet to find appropriate tests and treatments as well. So far as our knowledge goes, we are giving a treatment with the different aspects. Now, I just wanted to ask this question. What is this nitric oxide load exercises? I keep hearing that now. So especially for COVID, I believe it is recommended, especially for people who cannot exercise or like before in the sense before.
So with long COVID, every doctor is telling all my patients is go work, do exercise, you'll get better. But only word of advice, I have always been talking on behalf of long COVID physio worldwide also. Please do not exercise without the consultation of a physiotherapist trained in long COVID. Because as I said, many patients like Happy and Manasa and all, we never know how your heart rate jumps up when you walk or when you stand up also. And when you stand up and you want to walk a certain mile, your heart rate will keep jumping up. And that's the issue when we see with people just collapsing now in the gym. Maximum of the celebrities, you would have the news coming up that they collapse in the gym because they were working out really hard. And maximum, Sadiq is also here. We all have patients whose heart rate has been going up. It doesn't matter the age. It doesn't matter 21, 22, 40, 50, 70. Everybody's heart rate has just jumped over the roof. And that is a main classical thing which we will have to understand for exercises. Now, the nitric oxide overload is an exercise which is definitely very helpful to fight the COVID, primarily to the COVID. But once you get COVID, then we will not have to do it because the nitric oxide dump which happens, it requires a lot of work, which is overhead activity of the arms, which flushes the blood to the heart. So many of the people who have long COVID have dysautonomia, and because of that, their blood flow to the head and to the heart is compromised. The blood flow is only in the legs. So the nitric oxide dump cannot be done for people who have done post-COVID scenarios, but pre-COVID, everybody can do it. It does help many people to fight diabetes in a natural way. And it's a very good way to also go back and reverse your hypertension, basically. So basically, you will have to stand up and do a little moves in a certain format, and people can connect as because everybody's bodies we define as to these are number reps you should do, these are the movements you should be doing, not more than that. But all of them have got very good results from the nitric oxide dump. But as I said, precautions have to be maintained with people with arthritis and osteoarthritis also, because you require the knees to move very fast, and you also require the shoulder muscles to move. So you should have good shoulder muscle movement. If you have pain or any kind of frozen shoulders, we can't do it so efficiently. So there's a certain age group which can do this exercise in a very good way, but not something which I'll advise for people who are post-COVID or who have long COVID. Yeah, but long COVID, the word which is coming out very, very clearly is exercise as per your tolerance. Don't overdo anything, and don't just follow any fitness fads, because there's so much being said that, okay, you got COVID, come on, go jump and exercise. No, you can't do that. So you have to let your heart do the right job, let your lungs do the right job.
Great.
Yeah.
So that myth of nitric oxide dump is now done.
Yeah.
So only prior to COVID we can do. Probably
prior to
people,
COVID, when you're fitter. When you're fit. and fine, and you have good ability to breathe, you have good ability to exert force from the muscles, you should do it, but not when your body is already compromised with blood flows and all. Yeah.
Okay.
Yeah.
Any questions?
Namaste, Dr. Anjali.
Namaste.
It was a pleasure to be in a group where you are there. We have been following your links and suggestions. My name is Vijay. Long time back, I pinged you personally to tell you about the problem that I was facing. Approximately, I hope my voice, I am audible.
Yes.
Right, right.
Yeah, approximately 6 to 7 months ago, there was a situation where I was affected by COVID and recovered, and it's like 7 to 8 months after I recovered totally from COVID. I was in a situation where there was regular parties at my home. There was a big event, some fun event. So I used to consume some unusual amount of alcohol along with the family members and friends. But suddenly after a week, I stopped taking it. But at the 8th day, I started facing an issue. Like in the night, it was difficult. It was really difficult for me to sleep. The very next moment, I feel like I was entering. I was falling asleep. It was a feeling that my heart's getting stopped.
Okay.
I'm sorry if somebody has asked this question previously. I just joined now. So the whole night was like I felt like I got attacked for like multiple times, 8 to 9 times. I couldn't sleep. Next morning, I contacted one of my friends who is working as an interventional cardiologist, radiologist at some hospital in Vijayawada. He suggested me to immediately take some tablets called Cryptomer 30 mg or 20 mg for time period, and then immediately contact a doctor.
Right.
Then they suggested me it's nothing. It's just he studied my entire previous health conditions and all, and I have been working in different shifts like evening 7 to morning 4, night 10 to morning 7, and then morning afternoon 12 to night 4. So in the from the past 10 to 12 years, I was working in irregular shifts. So I am having a very bad insomnia problem. So the doctor said it's nothing. Maybe it's not about alcohol. You try stop quitting it and then start taking these pills for 50 days. And the tablet name was Nexito Plus. So after using that, I felt okay. But anytime after that, it's a story of approximately 6 months ago. But last month, I happened to be in a social event, and again the very next day, again I start having palpitations. I literally feel that, and there is a feeling of somebody is pinching at my heart. At the very next moment, I feel very tired, and then I want to sleep, but again I feel like my heart got stopped, and I could see some blank space somewhere. And then I'm coming. I mean, I'm losing my life, and it's a feeling like I'm losing my life and suddenly coming back to life. So for a fraction of a second, it's literally a feeling that I lost. My heart might stop breathing, and then automatically it came back to life. It's like that. Anyways, honestly, I'm not touching any of those so far. But again, is it going to affect in any other which way of consuming any other natural food or any other food which or something like some drinks like thumbs up or normal soft drink which also contains caffeine?
Yeah. So Vijay, as I said, whatever palpitation you are having is as happy also is one of the candidate here. I've told you this is something called as spots which we see in long COVID, and something where like alcohol is something which will trigger a lot of foods, drinks would trigger such kind of complex symptoms in long COVID patients. So alcohol is again inflammatory and again will cause your sugar to surge. And if you're taking it, especially post your dinner, and that's not the right time to be taking it. And most of the long COVID patients, I have asked them not to have alcohol at all. In the
Yes, ma'am. From past 1 month, I've decided. See, life is more important than personal enjoyment. I'm 35 years of old. I'm seeing at least coming 25 years with my family. I'm assuming my life. So I thought it's precious compared to any other social activity. So
Yeah.
I quit. I wanted to know: is there any other natural substitute which may also affect in the same way as alcohol does?
Yeah, Vijay, there's a lot of foods which will affect you, especially if you've had long COVID. As I already mentioned, a lot of foods are there which we shouldn't be having. And it all depends on one-to-one basis. We need to analyze you and then understand as to how your long COVID was and how much it is. And depending on your parameters, we can just take a look into that, Vijay. Yeah.
All right.
Thank you.
Thank you. I might try to personally take consultancy from you.
Okay.
Some online consultancy wherever you are, and I'll totally explain myself. Since I joined half an hour late, I'm really sorry for my ill manners. I drove 500 kilometers today, and I didn't know when I fell asleep. So suddenly I woke up and I saw this link in the group.
Okay. Thank you, Vijay, for joining.
Yeah.
Hope your doubt got cleared, and you can consult Dr. Anjali anytime, Vijay.
Yes, ma'am. Yes.
She's available online. And if you go back after we finish this, you can watch this video again, and you can find her number. I mentioned her number twice. You can call that number and take a point.
Sure, ma'am. Thank you very much. That helps a lot.
Yeah. So, any other questions?
These long COVID symptoms, or what all the complications which are going, why it is affecting only certain kind of population, and what could be the reason for that?
So, I've seen majority of the people are athletes or marathon runners who got real bad long COVID.
Okay.
And especially because the ACE2 inhibitors, which are there in all the blood vessels, right? And they might have got their body into an adrenal crisis.
Right.
COVID is causing adrenal crisis. And now when you actually run marathons, many of them do it out of passion, and some do it out of overexcitement sometimes.
Right.
And that's when you cause adrenal fatigue in the body, and the adrenal crisis which is happening is also affecting your, the whole biorhythm of the body, or basically the blood flow mechanism of the body. So the body is always into a constant fight and flight mode, not able to be calm. And when the body is not calm, it's all, everything is haywire, right? Everything is showing up. Your gut is gone, your sleep is gone, your breathing is gone. So it's all about getting everything collectively addressed together. And I see a lot of women who have PCOD and endometriosis especially have long COVID. And among the men are plenty of men who have symptoms after a certain age, like it's not like just 14, 15-year-old teenagers. Last week, I saw a young boy who was just 13. So I see a lot of long COVID kids also. So it's just not about adults. We see a lot of kids getting long COVID. And as it is, this patient has come from UK, didn't find an answer there because getting a doctor's appointment was definitely very difficult over there. So the mothers come asking for help in India, but the doctors don't understand here what long COVID means. She's saying, I think my son has got long COVID because he's bedridden, he's not able to get up from the bed. And all this has happened after he went to the school when schools opened in the UK. And after which I feel my child has been exposed and he's having a lot of muscle pains, a lot of body pains, not able to get up from the bed. And he's lost a lot of weight, he's having gastrointestinal symptoms. But why do we see that this small child is having the symptoms? So on trying to find out the history of the child, a lot of these people are on a lot of these processed food, junk food. One, as I said, marathoners, because they are beating the adrenaline totally off. A lot of PCOS, lot of people with endometriosis, which both are inflammatory marker, right? So endometriosis and PCOS is again inflammation in women's body, and that's again is the cause of long COVID in many. And a lot of people, I would say, have not got long COVID. They have long COVID, but they don't know they have long COVID because their body is so well with nutrition efficiency that they're absorbing well. Right. And they're able to fight it off, and they don't know that they have long COVID. That's a good parameter of people we have. But there's a long parameter where there's a lot of malabsorption, where the patients are not able to absorb the nutrition, especially if they have issues already lingering on from previous times. Right. So that's what I said, like people have to get their life little bit acclimatized with the natural habitat. People who are mostly on the phone, lot of Wi-Fi connections. So a lot of, I'll say that artificial ingredients around your house, which could be too much of gadgets, and people are all the time not sleeping in the night, are the ones getting it more bad. And among my younger lot patients, I would say are the all IT crowd, most of the IT crowds, especially because they don't move.
Right.
They don't move at all.
Right.
So obesity is one reason, but I have had patients who are very thin, they have had it also. So it doesn't matter obese or thin in those matters, but
nutrition
definitely matters in your nutritional level. It matters in what you were eating pre-COVID times.
Right.
Right. Now, if pre-COVID time I'm eating pizza, burger, and I've got my booster shots and yet I got COVID. Now, how will I say that? Okay, you still got COVID and still got long COVID. So a lot of things are related, and a lot of mental aptitude. I think a lot of fight and flight mode goes on in people's body all the time. Like we're very observatory in nature. Okay, something happens in the house, we'll be like panicking, right? We have that habit to panic. So the main goal is to not fight any disease with panic, but fight it with the way that it is not a disease. It is just a condition. I'll just get over with it. I think that's the way to look at it, because people are just getting panicked about it. Oh, I've got long COVID. Don't term it as that you've got it long COVID. You can fight it off. There's so many patients they've recovered, right? So I'd say there's light at the end of the tunnel. You just don't have to just focus on, oh, I have these many factors which are wrong. Don't look at your blood test. Don't look at what parameters your doctors are telling you. Just keep your mind as cool as possible. You can get over with it.
Okay. And considering the good parameters, as you were saying, so can this, I mean, as you said, the long COVID has residues of virus can be there. So can this be a boon for them, you know, from the new variants, or, you know, any such?
Very nice question, Mayuri. Wow, she's always brilliant with all her questions. I don't know from where she gets those questions.
So, just from your talk.
Yeah, so they are dead viral fragments, Mayuri. They are dead viral fragments.
Right.
Okay? And body is thinking it's a danger, it's an enemy. So the body is again getting inflamed and keep fighting with it. But always when the body is fighting mode, the body's immunity goes down.
Right.
Okay, so people who have had long COVID are again getting a new variant. And again, they are having a bad lapse of long COVID. So there are people who got vaccinated and then they got long COVID also.
Right.
So I have many in that pool also. So many, they never thought that they had COVID, but after vaccination, their symptoms are exactly like long COVID. So it's a mix and match, actually, I would say, of everything. But primarily, I would say is that everybody shouldn't be doing too much for their body in the initial months of recovery. If they let their body be as silent and as calm as possible, like, you know, there's a lot of yoga challenges happening now, like
yes,
Surya Namaskars, 180 degrees. You know, Surya Namaskars, 120 Surya Namaskars, the constant going towards gravity, going against gravity, the blood flow to the heart is compromised, especially for long COVIDs. They should never be doing the Surya Namaskars at all till they recover, till they get a green signal from all of us. Yes, do it. And there's a lot of people who say, okay, there's a celebrity who's doing a lot of marathons now. Let's get back to marathons. No, the word is no. There's no way you can actually do a marathon if you've had long COVID until unless you've got your the whole way of breathing, the way of controlling your heartbeat control, don't go and do that, because you'll harm yourself more. And we've already seen a lot of celebrities have gone to the gym, and we see that they're all, unnatural deaths are happening, which has to be controlled. And the word of advice to everybody is listening here is through your medium is, please listen to your body. Don't listen to everybody who's advising you all around you. Listen to your body, because your body will say something which others may not understand.
True.
Yeah.
Listen to your body. It's very important. Okay.
Yeah.
Is there any cutoff point as to understand the heart rate? Like, okay, my heart rate is this, I'm normal, or will it suddenly jump? It may be normal now, but we go out and doing exercise, will it suddenly jump? There can we have a cutoff point or something like that?
So we have that, we do that age minus your heart rate in 220, but that formula has to be used only when we are training somebody for a high altitude training or high levels of performance. So many of the long COVIDs, they don't come under the zone where they can even walk from one room to the other room. That's how many long COVIDs I have, right? They're standing up and they're falling off. Okay, so to train up at that zone, we don't actually go to that level. What our primary goal has been to get their heart rate to a level where when they stand up, it should not go up more than 100, basically. Okay, more than 100 is the zone. So any heartbeat which is 30 beats per minute going up from lying to sitting, we term it there is long COVID existing in that phenomena. And if these people go and run and do parameters like yoga, that will shoot up to 180, 220. There'll be nobody to help them out if they really collapse at that moment. So a lot of collapsing people are these parameter people whose people are not knowing their heart rate has gone up and they've fallen down. Okay, so majority of the time your heart will only give the signal that is beating very fast, but there will be no other signals. You might feel headache, you might feel like you're falling down, you might feel a lot of sweating, you might feel this tummy pain, and all these are symptoms that please stop. Please wait. Please stop and wait. Yeah.
Wait a second. Think.
Yeah.
Look at me.
Think.
What I'm suffering. Look at me. That's what body is telling to us when it shows up the pain. So, what are the 3 top advices that you can give to us today?
So my 3 advices are, please look into your vitamin D and B12. These are your saviors from COVID, preventing you from COVID, and helping the long COVID symptoms. Everyone, get out in the sun, take some that 20-minute sun in the mild sunlight, and get your, basic vitamins tested. If you have never tested it, that's one. Second thing is exercise with caution, right? And with precautions. So it's never a word of I will never push anybody who have recovered out of COVID for a yoga marathon or for any kind of marathons or gym workouts as of now. Because we have seen a lot of injuries happening also because the blood flow to the muscles is not there. And if you're exercising, many of the times, patients have something called as bone death or the hip necrosis is happening. The hip acetabulum is totally getting worn out because of the COVID and the medicine like steroids being given to them during the treatment also. So a lot of injuries are happening. So exercise with caution because your heart rate parameters should be in ideal levels for you to exercise at a very higher level. So mild walk, mild exercises to be done. Third is look after your nutrition level, which is your food. What food you are eating is very important. And not every food is good for long COVID. There's a lot of things which I have taken off the list for people who have long COVID. And A lot of people are doing good with something, a lot of people are not doing good with something. And especially if you have long COVID, avoid alcohol, avoid anything which is called binge eating junk foods, and a proper sleep is very important for your body to heal and recover. 8 hours of sleep, whether you get sleep or not, you got to give your body that lie down rest. And remember to rest and pace. This is the two top words which I'm telling to all the people of having COVID or have COVID. Don't break your body just trying to fulfill, some family members, I want to entertain my family member. I have to make, 10 batura cholas and I have to supply to my family members. No, and no, no. Make a simple food, eat yourself and give it to your family member. Don't tire yourself so much that you break your body and use up all the energy. So whatever energy long COVIDs have is this much. This is your reservoir. You need to only use this much energy. Don't try to demand this much. If you're demanding this much, that's when the body will shut down. So rest, recover, pace, conserve your energy. You'll fight it. Oh.
Thank you. Thank you so much.
Such a lovely advice for us, and it, in a very simple manner, she told us how to go about it.
We have one question. Pranit Reddy is asking, like, what is the best time to expose to get the adequate vitamin D?
So basically, if one has got long COVID, in terms of that, I'm saying avoid the long sun. So I'm not asking anybody to go out in the sun after 9, especially if you are in India. If you are in any other country, the sun is not harsh, you can go outside at that time, especially because if the long COVID patients under the sun might faint and might collapse. So the ideal time to go out is 7 to 8 when it's very peaceful and cold. The body temperatures are also cold and you can get your ideal vitamin D at that time. Yeah.
Right. Yes, doctor.
And any more questions?
No. We are done.
Okay. So if we are done, we can give.
Yeah, we are good to go for today. And I would like to convey my vote of thanks to Dr. Anjali for being here on T-Talks. I mean, she's here just with one call away kind of again. She's always here to help us and to educate our audience with all the necessary information which is whichever is needed when it comes to COVID or, the pregnancy, post-pregnancy, every time. She was here and has always been really, really helpful with all the tips and all the great information. And similarly today also for the long COVID session. Thank you so much, Dr. Anjali, for being here and for enlightening us with all the long COVID symptoms.
Thank you so much, Mayuri. Thank you, Dr. Janki. Dr. Anand has come, I think.
Yes, I think, yeah, that's what I was about to ask, Dr. Anand.
Hi, sir.
Sorry, I was in another Zoom meeting. I just finished that. Extremely sorry.
No problem. No problem. Welcome.
How are you, sir, Dr. Anand?
I'm fine. Thank you so much.
We just about to close the session, but we would like to listen from you. Would you like to give us any advice regarding long COVID, your experiences?
Yeah, I was heading CRPF. I was DG CRPF when the COVID came. And that was a huge, we have a force of 3.5 lakhs spread over the country in all the states. Okay. Now, since it is the largest internal security force and the law and order force in assistance of the states. So first, the challenge we faced was to protect our own people because they were to go on duty. We cannot say that we will not move out from house, we will work from home. This option was not available to the forces. Rather, they were the COVID warriors. So immediately, and that time we did not even know what to do. What are the precautions to be taken? So whatever the basic details were available with us. So we were to help the migrant laborers also in transporting them safely, because every individual check them out, to give them a camp, the food and whatever. We had to also ensure the security of the people who are going back even in the places like Delhi, they chuck the doctors and nurses out of their houses thinking that they were the people who will carry the, So there were extreme situations in the beginning. So what we did was, which we had learned initially, was that if the comorbidities are there, this affects more because it all depends on the immunity. So we focused on keeping the immunity high of our soldiers, protecting those who were suffering with comorbidities. We will not send them for the sensitive duties. Number three, we had it was quick. It was a quick preparation of the health department and other bodies, advisory bodies. I must thank them. They immediately came up with the mask and also with the suit, which the protection suits which they wear. So what we did was, we ourselves, since our requirement was too much, we ourselves bought the machines, set up the mask making machines. Even the ladies of the soldiers, they sat down to stitch masks from the clothes. So that is how we supplied masks to, not to even us, but also wherever the forces were deployed, we also gave it to the communities. And the Ministry of Home Affairs was also, this thing too. This is one thing we did during that period. And we realized, which we also realize now, that the social distancing and the mask is the only protection. And third is, what is in our hand is to raise the immunity, because we do not even know as to this date what type of virus, how it will mutate, what will be the intensity and the spread. So the only three things we also tell people right now: the safe distance, mask, and number three, don't let your immunity go down. Like your healthy lifestyles, drinking, smoking, or anything which brings down your immunity. Sleep well, exercise well, breathe well, whatever the immunity keeps high. So these are the three fundamentals which we have concluded even to this date. But I must tell you the type of problems which we faced was that when the people had an exodus and went to the villages. Now the villages were sharp enough at few places, and they will break the roads. So will not let anybody come back. Even in places like Rajasthan, Chhattisgarh, we found that they were very good at getting कि छूत की बीमारी है. इतना समझते थे कि छूत की बीमारी है, दूर रहना है. तो किसी को भी उन्होंने बाहर से आने नहीं दिया. They did not permit, and that had another problem. So there were issues after the issues, and then came this vaccination. So Government of India was quick enough to vaccinate the COVID workers. In that also, there were lots of resistance by the people. Somewhere it was politically created, somewhere it was otherwise created by the vested interest. And probably I think there was some huge money based fight between the various parties. So they did not want any one vaccine to come early in the market. And so there were many things, complications. So that was another challenge with us, to go and tell the people, convince them why and how they should have the vaccination. They should not resist it, because it is eventually going to lead for the safety. The community defense systems will be built in like that. And another, being in the forces in the remote areas, and I must thank the police forces, various, because when there was a complete lockdown, somebody's father was ill in Kashmir and his son was in Northeast. So we had to, shift those people road by road. And there was somebody getting pregnant. And another thing, there were labor camps. People will think that these laborers, these lower class people, or say such people, even jhuggi jhopdi people will, bring the COVID and spread the COVID. But that was not the case. I think they had more immunity within themselves, because they have been facing so many viruses day in, day out. It's something like this: a person from America comes to India, has a glass of water, falls sick. But we do not. Probably that was the reason. And those are the people who never felt so sick as it was the case with the higher income group, who were keeping themselves protected. Rather, I must tell you that I was working with some doctor during that period. So he jokingly said, what I do is, after 2 hours, I open my mask for 5 minutes. Mega, why do you do that? Well, I take low dose of exposure and keep building my immunity. He might have said it in a lighter mood, but then I find, yes, that is how we build our immunity also. So these are the eventual, I'm late, I should not take much time, but this is in just what we did and where we reached and how we reached. Thank you so much.
Great, sir. I
Great.
mean, this
Thank you,
information,
Andrea.
this information generally we don't get how, I mean, how they evolved to, and finally, the very first line of masking and social distancing remains constant of everything.
And
For the
immunity,
past
and
2
immunity.
days.
Immunity.
Yeah. Great. Thank you very much, sir, for coming. Even though it's the last minute, you didn't stop
No.
yourself, and you came online and.
Thank you for giving it time. I think it was destined like that.
Thank you so much, sir.
Great.
Great having you. We would like to invite you for another session too.
Definitely. I mean, if you invite me for either dealing with COVID or winning through difficult situations, I have worked in Assam, in Kashmir, in Maoist affected areas, or general motivational talks to the youngsters, I'll be very happy to participate.
Sure, sir.
Thank you so
Thank
much.
you.
Thank you.
Thank you, Anandya.
Thank you so much, sir. So once again, vote of thanks to Dr. Anand.
Yes. Thank you so much, Dr. Anand, for being here. With though you had a very short time, but you are here and you have enlightened us with that short talk. And thank you so much for being here on Tea Talks.
Thank you.
Thank you so much. So we'll meet again next Tuesday, same time.
Same place, yeah.
And
Bye for
especially
today.
this
Thank
is
you.
our anniversary month, so
Thank you.
we'll come with the exclusive content like this.
Thank you.
Thank you all. See you next Tuesday.
Bye.
Bye-bye.